I want to make the case for a well-being budget, but first, of course, I need to establish what's well-being and why should that be the driver. David mentioned it, but it's kind of crucial to this, that my decades in government have made me realize that it's actually much simpler than people think. That what governments should be doing, central, local, and in fact most organizations, should be trying to improve the well-being of the people. In particular, not just the averages, so making people who are doing very well, fantastically well, but actually looking at those people at the bottom end of the scale where they are living in misery, to be perfectly frank, and raising them up. And that basically increases average well-being. We're measuring it now. One of the things that David Cameron, remember him, he has done some good things, honestly. David Cameron started in 2010 through the Office of National Statistics, actually measuring national well-being. This is massively important because without the data, you can't work out what it is that is really important for people. And one of the things about the well-being agenda is it's so democratic. It's actually asking people what matters for your lives, what's important to you, and what's going to influence your well-being. So it's very bottom up. And as Caroline mentioned, I'm doing a lot of work with the charity that I chair, Pro Bono Economics, to actually look at community groups, civil society, and see how all of them fit into the pattern of our society. So not just looking at the charitable sector, but looking at how it fits with private sector and public sector, because that really hasn't been done before. And I'm working closely with people like Andy Haldane, Chief Economist at the Bank of England, but lots and lots of people who are very good with charities. So that's really important. At the macro level, budgets can basically determine lots of issues about tax and various things that we're going to put allocations towards. Actually, I'd say probably more important are spending reviews. Governments have these periods when they decide how they're going to allocate out the money. How is government spending going to be allocated? And surprise, surprise, mostly it isn't about improving people's qualities of life most. It's about various political aspects and all sorts of other games that go on in government. So if we could just start to use the very good data we're generating, you could start to build a budget around, well, what's the impact on this on people's lives? Now, other countries are starting to do this. New Zealand, Jacinda Ardern, who is probably one of the most popular prime ministers around the globe, is putting forward a wellbeing budget. They've been done in the people in Scotland, in Wales. You could argue the future generation stuff is all about this. Iceland, there are lots of countries. They're all quite good in my view, and they could be quite a lot better, but they're really a big step on the way to getting us there. If you think about what does this all mean, and Caroline mentioned that thing, which to me as a Treasury person is the last thing you want to hear. We all want more money, right? If you sit in the Treasury, all you ever hear is people asking for more money, right? So you need to be a bit more subtle than that. And it's all about prioritization. If you look at and Pro Bono Economics economists have done this, you look at the money that's been allocated to building back better. Right? We reckon at the moment there's about 172 billion out there. 163 billion of that is allocated to physical infrastructure, right? Do the maths. That really doesn't leave much left over. And if you think about this from a point of view of capital, physical capital, yes, infrastructure is important, but human capital and social capital, I've been talking recently about literacy. Andy Haldane's been talking about numeracy, these basic skills that are absolutely essential to get people into jobs, to help them retrain for future jobs. So that would be massively important. When you talk about social capital, you're talking about community groups, and you're talking about all of the things which it comes back to where this report is important. They come back to a basic principle, which is prevention is a lot cheaper than cure. If you want to improve the well-being of the nation, start by looking at children and education, right? We do not measure the well-being of our kids. We measure them to death in terms of exam results on maths and English and things like that. But actually, when we've done the research, and if you read Richard Layard's Origins of Happiness, you'll see that a better predictor of their future well-being, how happy they are with their lives, is their well-being when they were earlier on at school. And it's actually also better for getting them jobs. Curiously enough, people like people with interpersonal skills, with ability to work in teams, employers like that. Turns out that employers are beginning to realize that if you improve the well-being of your staff, their productivity goes up. Brilliant work by a guy called Jan Emmanuel Deneve at Oxford has done actually evidence-based stuff using employees at BT call centers to show those things are not just things we'd like to think are true, but are actually true. So that's all very important. What would it mean in terms of what you would do? Well, first of all, you would prioritize prevention rather than cure. This would be massive for the health service. First of all, mental health is an enormous issue. It's a scandal in our country that there are so many people who've been diagnosed with mental health issues who get no treatment. It can be a really important issue. I've been talking recently to various people in the new Biden administration about what might happen in the US about well-being, because they have some good aspects of some way they're way behind us. But one of the things that stuck with me was talking to someone who was working on military veterans there. And she was talking about the deaths caused by conflicts in Iraq and Afghanistan for US soldiers. And it came up like, what was the main cause of death for these people? And the main cause of death was suicide, post-trauma, right? More people died from suicides after they come back from Iraq and Afghanistan. This is US soldiers, than were killed in the fighting. So this just shows you how important mental health can be. Physical health. We spend an enormous amount of money right at the end of life. We spend an enormous amount of money on drugs. We spend a tiny fraction on prevention to stop people needing all of that. All of this stuff about well-being. We know that quality of people's lives is much affected by things like, whether they've good diet, exercise, all those sorts of things. And look at COVID, your probability of dying from COVID, if you're obese, is much higher than if you're not. So things like that, really important. So the well-being research has shown, get in there early. It's exactly what you're talking about early steps intervention. So children, early on, think about giving people the right skills and the ability to learn new skills, because believe me, one set of skills isn't going to do you through your 100-year life. For those of you who are going to have 100-year lives. Work is massively important for well-being, but particularly good work. Being out of a job is horrible. Anyone that's been made unemployed or redundant will tell you that. And it shows up in all the data. We now have really robust evidence about this. But not just any job. It's really important that it's good work and that you're given help in all of that. We're seeing that now, employees caring much more about the well-being of their staff during the whole COVID period. That's been great. Relationships matter a lot. So I would say, to sum it all up, if you've got governments that actually start to think about what I would regard as, to use the classic phrase, the bleeding obvious, improving the quality of the people. There's some great work by a guy called George Ward that shows that actually governments that improve the well-being of their people are much more likely to be re-elected. So it's in their own interest to do this, not just because it's the right thing to do, but it is the right thing to do. The vision thing, if you could just, everyone out there, all these political parties are searching for something, build back better, leveling up. Well, what's it about? It's about improving people's qualities of lives, and it's about leveling up. It's taking those people who've been left behind and improving their quality of life. How do you bring all this together with all the things that are in this report about early intervention, doing the right things, working with local communities? The answer is you give them an compass of what impact do they have on well-being. That allows you to give it a great evidence base. And I think that's the basis for all of this. So my big message would be, don't think this is all about spending money on roads. Do think it's all about intervening early and building people's human capital, their resilience. Caroline mentioned that word. I think that's hugely important. And we think for the future, something like climate change, it's going to be catastrophic for the well-being of future nations if we don't do something now. And so a well-being approach would really prioritize doing those sorts of things which are actually going to have a massive impact on well-being, not just of today, but of the future.